Greetings. This is Dazon, Dixon, Diallo, of course with Sisters Time. We are your audio magazine featuring the life, the health, the rhythm, and the culture of African women and those of you who love us. Right here on WRFG 89.3 FM, your station for progressive information and quality hand-picked music. I have the wonderful opportunity to sit right here with Loyce Maturu, who is with Y+, an outstanding youth-focused organization in Zimbabwe. And we're here together because we're actually sitting in somebody's office at the UNAIDS building in Geneva, Switzerland, participating in a WHO and a UNAIDS meeting talking about PrEP, pre-exposure prophylaxis, and guidelines for different populations. Today we've spent a lot of time talking about women, girls, youth, transgender individuals, and I'm just excited, Loyce, because you are here to represent the youth, and all of the youth, of course, but I really want to get some ideas, some thoughts from you about the work that you do, how that fits in with the meeting that we're participating in here, and just a little bit more about Loyce, like who you are, and why did you even get into this work? And actually, let's start with that, and then I want to talk about what we're talking about in the meeting. Is that fine?
Definitely.
Great. Yeah. So tell us a little bit about Loyce Maturu.
So Loyce Maturu was born in 1992.
Wow.
At a time before prevention of mother transmission was there.
Yes.
So I was born HIV positive, and of late both my parents are late. And what's so hurting for me is that my mother and my younger brother, they both passed away in the same week due to HIV-related illnesses. So currently I have been collecting medication, my ARVs, from Newlands Clinic. And from Newlands Clinic, that's when I managed to link up with an organization called the HIVEonline.org program. So then, as children of that time, we said we wanted to know if we're going to survive with HIV. If you say we're going to survive, we want to see other people who are also living with HIV. So that's how then we started to form a small support group of 5 children. That's how it all started for HIVEonline.org program. So from there, I've been a beneficiary. Then 2009, I became a peer counselor, where I have been more focusing on providing prevention, treatment, care, and support services for my peers living with HIV within the communities, and working in partnership with the clinics and the health care providers, and how they can provide treatment care in a friendly manner that best address issues to do with adolescents, young people, and children.
So you're really smart, beautiful, energetic. You got all of this going on. Not everybody who learns of their HIV status, whether it's through birth or through a transmission later on, makes the choice to come into this work and then start living not just with HIV, but living in the HIV world almost every day. What makes that happen? I don't want to just base it on why do you do that, but really what drives you to do that? Why aren't you doing something else? Why are you doing this part of your life in this work?
Yeah, that's a very good question, and it's very more of personal drive. Because as my parents passed away, I started shifting households of my paternal relatives. Sometimes I stay with an aunt, I stay with an uncle, I stay with a grandma. And I have been facing so many verbal abuse from some of my family members. So at some point they would start shouting, and you know how we live in Africa. Like you live in a house and there are some people who are also renting, and sometimes they would actually shout about my HIV status. You're HIV positive, do you think you're special, something like that. So obviously people got to know about my HIV status, and there was a time that I tried to kill myself. I took all of my ARVs, and the only person that I could tell that I took all of my ARVs, which were in my bottle, was the aunties from HIVEonline.org program. And they quickly phoned me and they said, come here at Jandi's office. That's when they drove me to a hospital. I was admitted there for 2 days. And from there on, they offered counseling, and I said to myself, if I'm going to survive in this world, I'm going to survive for my other peers. and to also make the world understand what we feel and to understand our challenges and needs within the world, and just to live in a world where we are seen as normal people. So that was my drive in coming publicly, talking about my HIV status. It was actually a personal experience, and looking at my peers, and because of my work that I was doing as a peer counselor, I could actually see the challenges that my other peers were facing. So it was actually a personal drive and also a drive for my peers who are also living with HIV, the challenges that they faced.
You know, I work under one of those principles that everyone has a story, and the power in that principle is that when you learn to honor and respect and learn from each other's stories, it changes your life. It changes lives, and you just changed mine. So thank you. No, really, thank you so very much. And I would, in another longer conversation, I could tell you all the ways in just a few moments you changed how I think, even about the power in the story that you just told. So in terms of working with your peers, I'm imagining that there are a lot of other positive youth that you have to interact with, that you're working to educate or advocate on behalf of and with. And I'm imagining that there are some who are positive and some who are not. But it's the age group, right? It's the people who are in your own network, who think and are like you. So I can get the story around the peer work with especially other youth who may have been born HIV positive and going through life and going through your own puberty time and your sexual debut and all of that kind of stuff. But tell me about the role that you play in the prevention side of it. I mean, there's a whole nother side of what has to happen in terms of working with people who are not positive and educating them, educating positive people, of course, about prevention, but people who are not HIV positive, you're in that work as well. Talk a little bit about how you see your role or what it is that you do in the prevention world or in the prevention spectrum of it.
Okay, so on the prevention side, because I was with the African Gender Program and being a global advocate, I started like 2 years back, not counting this year. So then I applied to be in the Y+ steering committee, where it's a Y+ network of global young people living with HIV. So there we have been more focusing on prevention, but at country level with my organization, working with young people and adolescents.
Right.
What I have seen on issues to do with prevention is particularly working with the adolescents and young people who are HIV positive, because we have been facing challenges where adolescents are sexually active and they do not disclose their HIV status to the other partner. Probably they might be negative or positive without knowing their HIV status. And there's been a high number and high increase of those cases happening. And we have been also trying to do campaign awarenesses within the schools and also in the general communities with different with community-based organizations, where we are trying to sensitize the communities and also providing information on issues to do with prevention methods.
Yes. So you're involved in the education. I'm sure you do some condom distribution like so many of us do in our communities, or at least talking about condoms and how to use them and where to find them. And a lot of this is focused in on making sure people understand their own roles and maybe even their responsibilities, their options, their behaviors even, right? But now we're in this conversation around how science has brought us new tools, right? We know more about what treatment can do in addition to elongating life and giving more quality of life for people living with HIV. We also now know that for people who have their treatment and are regimented to their treatment, that they follow their medication and they get their virus under control, that they actually are a big part of the prevention now because they are less likely to transmit. And so, but this conversation we're having is a little different because it's about people who are not positive being able to take a pill or maybe have some other tool that's still in the research, but we know now that there actually is a pill that can work. We call it PrEP, or pre-exposure prophylaxis. Why are you involved in PrEP? What does this mean for you or for the young people that you work with and on behalf of?
Basically, I can say being involved in the PrEP meeting with WHO and UNAIDS as a young woman who is living with HIV is to probably also give insight on the challenges, barriers, and the good part of ARVs and adherence, since it's also part of the PrEP initiative. So, and also to bring out what the voices of the young women and the adolescent girls would want within a certain community, because I'm Loyce, not coming from an office, but working within the community and hearing the views and perspectives of young women, and to really give an insight on the table of what would really work for us and what would not work for us because of the different challenges that we have been facing. Yeah.
So given what you've heard just in the last 2 days so far, we have another day to go. If someone in this meeting said, Loyce, what did the young women in Harare, in Zimbabwe, what insights did they send you here to tell us? Give us 3. What would you say? Here's what we think you should know.
Okay. The one, number 1 would be PrEP. Definitely they all need it, because looking at the African context, as young women and adolescents, we're not able to negotiate for safer sex, and also issues to do with accessing different prevention methods within a clinic setup. It's really difficult because of issues around stigma, issues around attitude of healthcare workers. There are a number of reasons why young women and adolescents cannot access these things, but they need these things. So then the issue would be to say how best PrEP can be delivered with a comprehensive package for support interventions that can actually help PrEP to be rolled out, so that young women and adolescent girls can actually access it.
Wow.
And also to make sure that in each and every planning process that is going to be done, there is need for involving and participation of young people and young women and adolescents to actually give an insight and some ideas and helping within the planning process of the whole package that is going to be delivered at national level or at community level.
The meaningful involvement.
Involvement, yeah.
So, there was a meeting prior to our meeting, which was mostly focused on men, especially men who have sex with men. And I think that probably had a different, feel or flavor to it, because there's been a lot of really powerful, positive data coming from research lately that shows this issue of PrEP really works well for men who use it, right? We don't have the same level of really positive data coming out of the studies about women, especially young women, with particularly the FACT study that was just reported out in Seattle just a couple of weeks ago. And, in the world where I work, especially for people who don't necessarily live and breathe in the research world, that they feel deflated by it. They feel that, okay, here's another failure. And I put failure in finger quotes because I don't think any trial is a failure, because we always learn something from them. But tell me, especially since everyone in the study were African women, Southern African women, and young, in your age range, where is this enthusiasm coming from? Why are they still so excited about this thing called PrEP, even when the data is saying that yes, it works if you use it, but you won't use it? That's what the research is saying, that girls won't use it, but it works for them when they do. Why would so many young women in your sphere still be so excited about it? What makes them excited about the idea of PrEP?
I think what's behind it is that as young women, and particularly, let me just say, young people, the issue is that young people do not always use condoms because of different reasons. Right. Most of the time they say, I really want to feel the actual person. So probably with PrEP, it can actually bring that, what can I say? It can make them feel what sex actually feels like, and also it's also a good thing because it prevents them from contracting HIV.
Yeah.
So that's a good thing for them. And also, what's more enthusiastic about young women and adolescent girls forthcoming about PrEP, probably I think it's because it's an initiative that can prevent them from issues to do with violence when they try to negotiate for safer sex.
Yes.
And it's actually a good thing because they will not go to the clinic consistently and asking for condoms.
Right.
But they just get a supply, probably a 3-week supply or a monthly supply, and no hassles to go back to the clinic.
Right. So that's a little controversial, so I'm going to take you there. That we talk about this thing PrEP in the context of combination prevention, right? That people still need education, people still need to do some behavioral modification, that people still might need to use condoms even. And it really scares, I think, I'm going to say the grown folk. Not me so much, because I'm twice the youth you are at 25 and 25. But anyway, that it really, freaks some people out to hear, especially young people say, we really would love this because we may not or don't want a life with condoms. We don't want to be beholden to condoms. And really, people are not ready to hear that there may be other prevention options that allow folks to not have to use condoms. Even if they still do, it may or may not be so necessary. How do you all handle that, or what do you think about that as a controversy around condoms with or without PrEP, that PrEP might maybe become the replacement for condoms, and then that creates other problems like around sexually transmitted infections and other things like that? What do you all say, or what do you think about that?
It's really a controversial situation. But from my own perspectives, I can actually say that probably there will be need for more advocacy around that to really sensitize the young women and the adolescent girls on the good thing about PrEP, but to also consider other HIV prevention methods that have been there, and to actually say PrEP is not a standalone HIV prevention method, but we can actually work with other HIV prevention methods that have been already there, only if we have advocacy and sensitizing them, providing information for them, and having probably dialogues for young women and adolescent girls, and also probably working in partnership with civil society, because they have a key role in also making sure that HIV prevention is practiced within adolescent girls and young women. So I think if you also involve those key stakeholders, we can actually have something good, and we'll be able to achieve zero new HIV infections among adolescents and young women.
And that's the aim, isn't it?
Very true.
So I have two more, I hope quick, I don't know about quick, but short questions. And one of them is about the fact that so much of our conversation is around sexual health, sexuality, sexual identity, and all of that. And I'm just consistently curious about, especially for very young HIV positive people who are growing into their own sexual lives, what are some of the challenges, and what are also some of the empowering things that you've experienced as you learn about how to live this life growing older? And also as a human being who's possibly a sexual human being, what does that mean in your life? Is it hard? Is it something that you've gotten used to? Or you just one of those strong sisters that's like, you know what, this is who I am and this is how I roll.
Yeah.
But what does it mean for you?
Okay, probably for me and my other peers, because I've been working in this for more than like 5 years. And it's really difficult, especially when you don't have support around you and you don't really know whom to talk to, whom can you trust. And you know, some of the challenges that we come across, especially when you grow up to become adolescent, you know, there are different developmental stages that are going on to an adult, and some of the issues around relationships, and you know, how to disclose. Should I disclose? Should I not disclose to my partner? You know, and should I tell him? Should I tell her that I'm HIV positive? If I tell him, will he accept me as who I am? Should I just keep quiet? You know, those kind of questions that will be ringing in their mind. And also issues around adherence. It's been really an alarming thing within adolescents and young women. Because there haven't been strong community support interventions around adherence, and actually to make them retained into care, that has been a huge problem and a challenge, especially even for the Ministry of Health to actually come up with a strategy to keep adolescents and young women, not only young women, but in general young people retained in care. And also issues around stigma and discrimination, that has been a huge challenge within adolescents and young people living with HIV. Stigma within the community, within schools, especially for adolescents and young women who've got molluscum. You know, it actually shows that you are positive, and issues to do with side effects of drugs that have been there with Stalanev, though it has been phased out, but you know, with Stalanev, you have permanent side effects.
Right.
Yeah.
Right.
Yeah. So that has been some of the challenges that we've been facing, and issues to do with accessing the drugs, because some of the health facilities, they ask you to pay a certain amount, like a user fee, and some of the adolescents and young people are not financially stable. They probably they're staying with their grandma, they're staying with an aunt, probably they don't really care about their own the child adolescent health. So it's quite a huge number of issues, and issues around sexual and reproductive health. You know, healthcare workers and caregivers don't really want to accept that young people and adolescents.
We just had a whole conversation about friendly service providers, right? Or friendly spaces, and it seemed that a lot of that was mostly around sex workers, but that can be a real conversation around young people accessing sexual health services as well. So, you know, I'm one of these old heads who's been in the fight for a very long time around microbicides and now PrEP, because, you know, we've worked with this saying all along that we really want the power to prevent in women's hands, right? So my question, maybe the last one, or maybe it's a two-parter, is as you think about PrEP, which is the first thing that we know we have, that in my mind is the only thing right now, because we have male condoms, we have female condoms, and either way, women still have to negotiate these things, right? But in my mind, I think of PrEP as one of those, the only thing that we have right now that is an autonomous thing, that you can decide to take it. You don't have to talk with anyone else about it or anything like that. And there's been some debate about that as well. So I'm just going to ask you, is PrEP a power tool for young people to prevent? Is it something that empowers them to have the agency themselves with no one else involved if they don't want to? Is it a tool for young women's sexual power?
Honestly speaking, from a personal perspective, I think it will be a powerful tool for adolescent girls and young women. But coming to the different contexts of different countries and young women, we are different within the countries that we come from. So, but just speaking from a young woman perspective, I definitely think that it will be an empowering tool because of the different challenges that young women in particular have been facing in negotiating for safer sex. And you know, they end up having HIV, and we're talking about 0 new HIV infections. So, and we no longer want anyone who's going to be born with HIV or who's going to contract HIV, especially among adolescents and young women, where there has been a huge increase of HIV infection. So I think probably it will be an empowering tool. Yeah,
Excellent.
I'll go with PrEP.
I like that.
Yeah.
We started with a question about Loyce,
Yeah.
so I'm going to end with a question about Loyce.
Okay.
And because I started in this work when I was 17
Okay.
in sexual and reproductive health and then HIV. And so I want to ask you, other than the work that you do with Y Plus and with the other organizations you're involved in, what other things does Loyce like? What do you like to do?
That's a good question.
And I'm asking because I want to make sure that you have many other pieces in your life that keep you whole and happy, because you're going to be doing this a long time.
Yeah.
So I want you to be very intentional about thinking about the other things that bring you joy.
Okay. So the other things that bring me joy, they're quite different.
Mm-hmm.
So, you know, having people who support you all the way, you know, and being HIV positive, you know, it's really a difficult thing. But it's really an easy thing when you have support around you.
Mm-hmm.
And Africa Gender Program have been just like a family to me.
Mm-hmm.
And they bring me joy inside my life every time. And even my peers that I always see on my daily work, they always bring me joy and that fulfillment to always live. But I say to myself that one day I want to be a global advocate.
Mm-hmm.
And just to my surprise, I ended up, you know, being
Here
a global.
you are.
Yeah, I am. And it's so exciting for me because that's where my passion is.
Mm-hmm.
And right now I'm working on my secondary education.
Yes.
And I'm hoping that when I finish, I will do something that will help me to remain sustained within my career.
Mm-hmm.
But my wish is to also become a TV presenter on issues around
Nice.
HIV and AIDS issues.
Nice.
Yeah. So
Excellent. Well, I was just going to say, you know, I've been doing this work for a long time, but I've also been doing radio for a long time because radio is my other passion. So I'd give me some elbows on that. I'm with you on that. And I just want to say thank you so much. Thank you for doing this with us. I should have mentioned that, you know, we have this incredible camera person / producer / ally, Shannon Weber, who's with HIVE at the University of California in San Francisco. And that's a hub on sexual and reproductive health right there in the United States. And I just wanted to say thank you not only for being here, but also for just being and for doing what you do.
Jeez.
And because, you know, I think it comes from the Bible. It may come from Shakespeare. I don't remember. But the whole notion that I also live by is, and the youth shall lead us. But we have to be smart enough to follow. And so I just want to thank you for being one of my leaders.
Not a problem. You're very much welcome. And thank you for this opportunity.
Absolutely.
Yes.
See, you're going to be on TV already. It'll be internet. But Loyce Maturu with Y+, Harare, Zimbabwe. Thank you so much.
Welcome.